For the first time from one of the patients stricken by a deadly superbug that spread at several local hospitals. But how did it happen? And who's most at risk? And what does it mean for you and your loved ones? For Steve Wilkinson, a retired flight attendant of Lompoc, life had been a globe-trotting adventure. He was preparing to get married last December when
I went in for a basic common procedure.
A procedure performed more than 600,000 times a year in the U.S. using a duodenoscope to drain fluid buildup on his pancreas. Last December, Wilkinson received that treatment at Ronald Reagan UCLA Medical Center. The procedure was successful.
I was at my peak. I was feeling this high.
But within 2 months, Wilkinson's health alarmingly declined.
I was completely knocked down.
Wilkinson's fever spiked for days. He was hospitalized. Around the same time, UCLA Medical Center sent Wilkinson a test kit notifying him of potential exposure to CRE, a superbug, during his December medical procedure.
I got a phone call from the director of epidemiology, and he said, unfortunately, you have tested positive for the bacteria.
How did you react when you found out?
Very, very depressed, worried, fear.
Wilkinson would spend weeks in the hospital, unsure if he would ever leave.
There were nights that I would look up to the ceiling and say, God, if this is going to kill me, please take me tonight, because I can't take this. Because I can't take it anymore.
CRE stands for carbapenem resistant Enterobacteriaceae. When we say carbapenem resistant, we're referring to an antibiotic that's called carbapenem that's reserved as a last resort when other antibiotics fail. So here we have a group of bacteria that are resistant to a very important antibiotic.
Dr. Jeffrey Gunzenhauser is the interim health officer with the LA County Department of Public Health, which is investigating the CRE outbreaks.
CRE is only occurring in healthcare settings, and generally the majority of patients who get this are very sick individuals.
So what's believed to be causing the cluster outbreaks? Doctors began zeroing in on a cause: the superbug possibly spreading on scopes like these, which some experts say, even when cleaned properly, could still transfer the bacteria from patient to patient.
It's been cleaned and sterilized, and every effort has been made to make it safe. It could be used on another patient later, and there's a chance that person then could come down with the same infection.
Since the beginning of the year, according to the LA County Department of Public Health, there have been 15 patients who contracted highly resistant bacterial infections from duodenoscope use in Los Angeles area hospitals. 2 of the 15 patients died.
Olympus knew that there was a problem with this particular scope in Europe going back to 2013.
Brian Kabateck represents Wilkinson in a products liability lawsuit filed against Olympus, the manufacturers of the duodenoscope used in Wilkinson's medical procedure. The complaint alleges that the design makes it hard to access all areas of the device, and that Olympus alerted customers in Europe of possible contamination issues if the device is not adequately cleaned.
And this lawsuit is about patient safety. What we don't understand is why they didn't advise anybody in the United States until 2015.
Olympus America refused to speak on camera, but in a written statement said, "This issue is receiving the highest level of attention at Olympus. The emergence of drug-resistant microorganisms is a challenge to the entire healthcare community. Olympus is working with relevant medical societies and our customers in research of this emerging issue and the development of additional safeguards to prevent infection associated with endoscopic procedures." In June, Wilkinson started putting weight back on, nearly 40 pounds. Now he has fewer days with nausea and side effects from medicine, but still does not feel well.
I feel like I have a severe flu daily, and it doesn't go away.
There are some bright days. In August, he got married.
Stephen, do you take Paul to be your married spouse?
I do.
But his illness is always on his mind.
There's always a constant fear that the CRE is going to flare back up. Live each day to the fullest, because you never know if it's going to be your last. I now know what that means.
Now, we reached out to Ronald Reagan UCLA Medical Center, but they declined to comment. You can find Olympus's full statement on cbsla.com.
You know, a lot of people are probably wondering, you know, what you need to know as a patient and what should you ask your doctor?
Yeah, for sure, Paul. There are several things or several tips that we'd like to tell people to. For one, ask your doctor why you need this procedure, why it's necessary. And you also want to talk to your doctor about the risks. Do the risks outweigh the benefits? And ask about alternatives, like waiting a little longer and if there are other procedures available in the meantime. This has to be solved. Olympus still has to make some kind of changes, and the hospitals have to accept everything. But right now, there are a lot of questions that are still being asked, and we're not getting the answers that we really want from the hospitals at this
You know, I
time.
do think the biggest hurdle is just asking your doctor, because we're always intimidated by our doctors.
Sure.
They're sort of the reservoir of knowledge, you know.
Yeah, and it's not like you're not trusting them, but you have to find out some information yourself and then research it a little further.
Yeah.